Selective mutism is a type of anxiety disorder in which an individual consistently fails to speak in specific social situations where there is an expectation for speaking, despite speaking normally in other situations. For example, children with selective mutism fail to speak to teachers or classmates at school, but have no difficulty speaking with parents and siblings at home. Estimates of the prevalence of selective mutism range from 0.03 to 2%. That might seem low, but to put that into perspective, the prevalence of autism spectrum disorder is about 1.7%. In almost all cases, children with selective mutism diagnosis are also diagnosed with another anxiety disorder, most commonly social phobia, separation anxiety disorder, or specific phobia. Symptoms of selective mutism often present between the ages of 3 and 5 years, although diagnosis is often delayed until elementary school, where the absence of speech is more noticeable. Selective mutism may persist for months or even years and may result in social impairment, as children with the disorder may be too anxious to engage in reciprocal interaction with their peers and become isolated. Furthermore, left untreated, selective mutism frequently leads to academic impairment because children cannot effectively communicate their needs to their teachers. It is highly recommended to seek intervention as soon as possible because even though symptoms of selective mutism may disappear on their own in some cases, very often symptoms of social anxiety disorder remain and can even persist into adulthood. It's important to remember that children with selective mutism, by definition, are able to appropriately communicate verbally under certain conditions and in certain social situations. In fact, many parents report that their selectively mute child is inquisitive, loud, funny, sociable, talkative, and even forceful and oppositional at home. Home is often their comfort zone. When outside their comfort zone, a child with selective mutism might withdraw or avoid the situation entirely, complain of physical symptoms such as headache or stomachache, show a lack of eye contact, stare blankly into space, be stiff or awkward in their body language, refuse to follow directions, and even be defiant. Instead of communicating by standard verbalization, some children with selective mutism might communicate by using gestures, nodding or shaking their head, speaking in monosyllabic, short, or monotone utterances, or speaking in an altered voice. In addition to clinical observations and interactions with the child, psychologists also gather information from multiple informants in different settings with regard to the frequency and severity of a child's mutism. They assess the academic and social impairment that result from the child's failure to speak. They also ask about and weigh previous attempts to intervene and resolve symptoms. Each child with selective mutism is unique and thus may respond differently to different types of interventions. When parents bring their child in for treatment, they almost always state that their primary goal is to get their child to speak outside the home. That is understandable, but especially at the beginning of treatment, all expectations for a child speaking outside of their comfort zone should be put on hold. Selective mutism is an anxiety disorder, so treatment should instead be aimed at decreasing anxiety and increasing self-esteem and self-confidence. The idea being that if a child is not feeling anxious or pressured to speak, and if they feel that they have the tools they need to speak comfortably, their communication will increase and progress in quality. Psychologists often work with parents and teachers to establish or adjust expectations for communication based on the child's current level of functioning. One change that can be made in the classroom, for example, is to temporarily eliminate the use of evaluative practices such as asking the child to read out loud or give an oral presentation. Another change that can be made by parents is not forcing their child to speak to a person with whom they are not yet comfortable, like an extended family member, or in a setting in which they are not yet comfortable, like a friend who they can talk to with ease at home, but not on the school bus. When a child feels like they're forced or expected to do something that makes them anxious, their inability to succeed may very well hurt their self-confidence, thus perpetuating the cycle of anxiety. Some effective interventions for treating selective mutism, used either on their own or in concert with each other, include pharmacological treatments, cognitive behavioral therapy, play therapy, occupational therapy, speech and language interventions, and social skill building. Many psychologists will develop a goal ladder in collaboration with the child and their parents. This ladder will provide the child with a visual hierarchy of goals to which they can refer as they progress. A typical first rung goal for a child with severe selective mutism might be to communicate non-verbally, for instance by using pictograms or gestures. The next rung up might be nodding yes or shaking their head no to questions. The next rung up might be mouthing words followed by whispering them. From there, the next rung may involve vocalizing a word or two, maybe to someone they trust or with whom they feel more comfortable. This ladder climbing continues until the child is able to speak with a regular voice in all settings. It's important for parents and teachers to understand that it might take a long time for a child to progress from one rung of the ladder to the next. And it's even normal for a child to regress down their ladder if they're feeling overwhelmed. If you are concerned that your child may have selective mutism, seek help from a professional who specializes in the assessment and treatment of anxiety disorders in children. In the meantime, make it clear to your child that you understand that it is hard and perhaps scary for them to speak sometimes, and that you will be there to support and help them along the way. Be sure to remove all pressure and expectations for your child to speak when outside their comfort zone. This does not mean isolating your child. It means making sure they understand that if they cannot yet speak in all settings, you won't be upset. A final tip: although the temptation might be strong, be aware that overjoyed, grandiose reactions to whenever your child does start speaking outside their comfort zone might have the unintended effect of making them more anxious and self-conscious. Instead, calmly and appropriately acknowledge what they have said, just as you would a child without selective mutism, and move on.